Yeah, that's fine.
Tell me when you're going.
I'm doing it.
Okay. So, what we're doing with Kirsten right now is we are making sure the muscles are lengthened and calm, which makes them able for us to work with them. So we start by extending her foot upward. We do see muscle spasms, so there's definitely some messages getting through from her brain to her body, but these aren't controlled spasms, and most of the time she can't feel what we're doing. But using quantum neurology, which is what we're doing, it's a technique that was developed by George Gonzalez. And if you have questions, go to quantumneurology.com. They have a very cool website which has a lot of information on it. George's wife actually had a pretty moderate spinal cord injury where she was injured and couldn't work, couldn't do the things she wanted. She was having trouble with moving her legs and muscle coordination. He developed a system to overcome that, which in and of itself is unique because there is no medical doctrine, no protocols for how to treat nerve damage. There's ways to deal with symptoms and other things, but he has actually found a way to turn, I guess saying it lightly, to turn nerves back on, to reactivate them, and help the body to heal itself. So once we get done, we actually go to very specific points, and what we're trying to do is activate nerve pathways through a variety of sensory stuff. So your basic senses are sight, sound, taste, touch, vibration, heat, cold, light pressure, deep pressure, and pain. And because Kirsten has no feeling below T6 or diminished feeling, like where there's no feeling down here, we're using pain pathways to try and activate these. And I'm not trying to put her in pain, but we are touching on some of the most basic nerve patterns that people have to see if we can get a response where for a few seconds we do get activation.
And will you explain why that's significant, why she pulls her leg up and then holds it in place?
Well, it's significant. So this isn't something that she's not deciding to bend her knee or her leg. We are activating something where if a normal person went and put their hand on a hot stove, your reaction is to pull away. You don't have to think about it. You don't have to think about your heartbeat. You don't have to think about blinking your eyes or digesting food. These reactions are automatic. It's not something that she's controlling. But what this means to us is, if you think about the way, even something simple like you sign your name. If I ask you to sign your name with your dominant hand, the one you've always used, your signature comes out as a smooth flowing script, no matter how you do it. It's been practiced so many times, you can do that. Now, if I ask you to do the same thing with your offhand, you can actually still concentrate, sit down, and sign your name. But the smoothness, the fluidity, the way you sign it is different because now you have to do it with effort. It's not something that you can do without thinking about it. And what that means to us is those same patterns that make your signature fluid by doing it over and over again. What we're going to do is we're going to reactivate those same pathways. We're going to reteach her body the basic mechanisms and movements to help stimulate these nerves. We don't know where this goes. Like I said, this is a very, there's not a lot of research over the years that's been done on how to do what we're doing. So we go through and we do the basic patterns. And what happens is, from talking with Kirsten, she starts to get more sensory. She can feel vibration when we put it against her heel, when we put her foot in certain positions and do that, she can actually see the motions. And so we're activating the most basic of pathways and trying to get her body to heal itself. As a doctor, as a healer, I don't believe that there's a lot that I do. I am a facilitator. I help your body, your brain in particular, connect to the rest of your body. That connection, your brain needs to be in contact with every cell in your body constantly, all the time. And if something's blocking that communication, like her injury where a vertebra was shattered, the surgery that she had after that, the swelling and inflammation along the spinal cord, we are trying to induce sensory and motor feedback to her brain. So we're trying to get those nerves activated because motion is life. And so when we're in here and we're doing this, we are trying to get these pathways to activate. When she does the exercises at home where we teach her basic cross crawl patterns, which is the first thing people learn. When you're a baby and you roll over on your stomach for the first time and decide to go look around, you do cross crawl. This is the most basic pattern that humans use for movement. And so the exercises we're getting her to do at home are cross crawl. We are trying to build more of these new pathways. If the old pathways don't work anymore, we're going to try and regrow new ones or strengthen the ones that we do have, which, coming back to the signature, that's all a signature is. The reason your dominant hand is so fluid and fast is because the more you do it, every time you do it, it builds another little bridge, another little pathway that makes that connection faster and more fluid. Your offhand doesn't have those connections, but if we can strengthen the ones that are weak, we can hopefully develop new patterns or rebuild the old ones or help her body heal itself, because everything that you need to heal is already genetically encoded inside you. The information is there. If you're not getting the right food, if you've got toxins or infections or heavy metals, there's things that are blocking you from being healthy, your body won't heal it the way it's supposed to. So as a chiropractor, I'm trained in structure. I do nervous system stuff, brain, spinal cord, bones. I'm comfortable adjusting all the joints. But we also do nutrition. We also do toxicity. And there's also a component of stress. There is a neurological or a neuroemotional connection to all this, where stress can actually overwhelm your system and shut down your digestion. It can affect your sleep patterns, other things. So here at Living Well, we try and attack everything. Like, we go big picture. I want to get as much done as fast as possible. So these treatments are designed to strengthen those areas. And when she lifts her legs up, I don't have to help her or do anything. And it usually holds for a few seconds. But for someone who came in and hadn't been able to move her own legs, or maybe someone hadn't shown her these pathways, when she sees it, I hope it gives her hope. I hope that I hope that when you feel the vibrations and when we do the tapping and the lights and we do all this different sensory stuff, I hope it gives you hope, because it does matter. Like, your mindset matters. Like, we have to work on that as well. Mm-hmm. But to not be able to move anything and then be able to see stuff like this, I think it's amazing. Like, and it's why I'm pursuing. Like, I want to get certified in quantum neurology. I leave for LA tomorrow to go to another class. Like, I'm excited. But this is the stuff I want to dedicate my life to. I want to hopefully be the best at what I do. All right, we're going to test point number 2. That time we got a little residual from the other leg. And that's what we're starting to see. When we first tried these pathways, we weren't getting a lot of activation. I would have to go very deep. And basically what I'm doing is I am squeezing. I am putting my fingers on those nerve roots, the very deepest nerve roots that come down, and we're actually putting pressure on them. It would probably be something akin to like hitting your funny bone. We're hitting a big nerve and we're trying to get a big reaction. And for someone who can't or shouldn't be able to move her legs to be able to see that, hopefully is a very good thing, a very positive thing. But we are doing everything we can think of to work this, and we're going to see where it ends up in the long run. And
then you said that basically you'll keep trying things.
Yep.
You keep doing new things, and if something doesn't work, then you go to something else.
Yeah, this approach, since this protocol by Dr. Gonzalez has been developed, there are people out there who have worked with patients who have similar injuries, and we're trying to build a collective knowledge base. Like, we want to figure out the best ways, like, because a lot of this is trial and error. There's no book I can go to that says do this, and do this. These nerve tests, like going in and squeezing the feet, in medical school, chiropractic school, for us, these are taught as diagnostic tests. Like, if there's a weakness in a certain area, you just write it down, weak at this area. What I'm seeing with this is now we're finding a weakness and we go in and strengthen it. So for these 3 points that we just did, we did 3 different nerve roots on her foot. Deep pressure, really deep pressure is what we're doing there. But we also introduce light and deep touch. This is an arthrostim, and it basically just taps. And the harder I push against my hand over here, the harder it taps. But we use as many different sensory inputs as possible. We want to activate as many nerve pathways as possible. We want to strengthen and heal and build. So we use vibration. We'll get in and use a percussor. A percussor is basically like a giant massager, kind of like the thing that you did at Brookstone. We'll go through and do vibration, and there are points when we do these. So we do each foot separately, and we put as much input as we can into it. And it doesn't take a lot. I mean, right away her foot starts, her leg starts responding to it. A lot of this isn't conscious, I don't think.